Hi everyone, and welcome to this review of Anatomy Practical 1 for Caesar Z102, where we'll be looking at the reproductive system of people assigned male at birth. So hopefully you've had a chance to go through this content. There's lots to have a look at here. There's a sort of a checklist here of the things you should be able to identify, the various little mini things here to identify things, tables to complete, tasks to test yourself, and so on. So you make your way through that. What I thought I'd do is spend just a little bit of time just actually having a look at a couple of anatomical models, just for your benefit, as a review what you might have seen if there was a face-to-face practical supporting this content. So yeah, hopefully you found it interesting and it reinforced the content from the pre-classes. There's a little clinical application there, a little bit of histology showing the structure, function of the seminiferous tubules and spermatogenesis and so on, and our final product, which is of course the male gamete, which is the spermatozoon, as we like to say. Alright, so what I'm going to do is I'm going to try something new. I haven't tried this before. We've got a little document camera here, and I'm going to try to point out some features on an anatomical model. Okay, so here's our first anatomical model. We can see it's sort of a bisected pelvis through a sagittal section. So a sagittal section sort of divides the person into two halves. This one's a mid-sagittal section. So we're sort of showing, well, just slightly off and dissected around here. So this is, of course, the male pelvis. So back here we've got the sacrum. So this is posterior, this is anterior. So we've got the pelvic bone here. So this is the anterior abdominal wall. And then, of course, we've got the male reproductive system. So we've got the scrotum sitting here. And, of course, the testis is housed within the scrotum. This structure here, this is representing the epididymis. So we know the sperm are produced within the seminiferous tubules here. They then travel through a series of ducts from the seminiferous tubules to the straight tubules, to the retitestis, to the efferent ductules, and then to the ductus deferens. And then they make their way through the head, and then the body, the tail region of the epididymis, and of course they gain their ability to undergo swim on their own, so they gain forward motility as they transit the epididymis, and then that becomes continuous with the ductus deferens, which runs within this structure here. So this is actually the spermatic cord. You can actually see it running up here. It actually originates through a little opening in connective tissue here called the inguinal canal. So there's the inguinal ligament would be running this way, and then there's a little opening, and as the testes actually begin development up in the abdomen, they migrate down through the inguinal canal. As they do, of course, they drag their blood supply, and so they drag it down as well as their peritoneal coverings, and then they move down into the scrotum. Now sometimes that doesn't always work, and sometimes the testis may not migrate all the way down. They may end up within the abdominal cavity. We know that temperature is very important for normal spermatogenesis, so things may have problems there with sperm production, but also there's a higher frequency of testicular cancers because of the higher temperature. If they don't migrate completely down into the scrotum, and that's something called cryptochordism, where the testis hasn't migrated all the way down to the scrotum. So when a baby with external male genitalia is born, the pediatrician will often feel the scrotum to determine whether both testes have descended properly. If not, they just watch that for a little while, and if the testes still haven't descended by that stage, then surgery may be required to actually move the testis into the scrotum. So as I say, as they migrate through the inguinal canal and come to lie within the scrotum, they drag their blood supply as well. So in fact, we'll see that the testis and the ovaries actually begin development up near the kidneys. They're sort of almost like an offshoot of the kidneys, or of the embryonic tissue from the kidneys. And So they actually migrate down from there, and their blood supply is right there. So actually you end up with a branch of the abdominal aorta forming the renal arteries, and then very soon afterwards we have branches of the gonadal arteries, which are, you know, either testicular or ovarian arteries. So they start up really high in the abdomen near the kidneys, because that's where the embryonic development begins, and then they drag that blood supply. Now, in people with ovaries, of course the ovaries only descend into the pelvis, whereas in the males they descend all the way through into the scrotum here, the external region. So we can see here as well, we've got these pampiniform plexus of veins. We've got this lovely sort of countercurrent heat exchange with the testicular artery here and the pampiniform plexus of veins, so that the cool blood from the skin that's being returned to the heart via the plexus of veins here cools the incoming warm arterial blood, so that the blood supplying the testis is a lower temperature, so that we can maintain normal spermatogenesis there. I don't know how well we can see, so here within here as well, we can't actually see it, we might actually have to remove this, but the ductus deferens is within there as well. So that's running up there through the inguinal canal, and then, I don't know how well we can see, it runs up here, runs to the posterior surface of the bladder. This here, this is representing the ureter, so this is actually coming from the kidney, so this is the urinary bladder here. And then, so here we actually have the ductus deferens, and then this structure here, this is actually the one of the seminal vesicles. You can actually take that little bit off there, I don't know how we can see. So that's number 7 there, is representing the seminal vesicle. So we've got the ductus deferens coming around here. As I said before, this is the ureter, so that's coming from the kidneys. So this is the urinary bladder. So there's the ductus deferens, comes to the posterior surface of the urinary bladder, joins onto the duct with the seminal vesicles, and then eventually forms the ejaculatory duct, which is inside this structure here, which of course is the prostate gland. So that sits inferior to the urinary bladder here, so that's the prostate gland. So I'm going to take this off now. So here we've actually got sort of the better idea what we're looking at here. So here's the urinary bladder, and then here's what we call the pre-prostatic urethra. So this is the first part of the urethra as it passes through the wall of the urinary bladder. So we actually have a thickening of this detrusor muscle, which is the muscle of the urinary bladder wall. So here, so this thickening here of the detrusor muscle helps to form what's known as the internal urethral sphincter. So when males undergo ejaculation, one of the things that happens is that this internal urethral sphincter constricts and prevents retrograde ejaculation into the urinary bladder, so that everything is forced out through the urethra and then down out through the penis, of course. So here we've got the duct, duct of the seminal vesicle and the ductus deferens, and then that's going to form this short duct here. This is the ejaculatory duct, so this is the prostate. So here's the prostatic urethra, and we can see the ejaculatory duct emptying into the prostatic urethra here. It then passes into this region here. I don't think this part comes off, unfortunately. So I think we'll see it on another anatomical model. We then have the membranous urethra as it passes through the urogenital diaphragm and then enters into the penile or the spongy urethra here. So here we have the penis, of course. We're ending in the glans penis, and then the external urethral orifice is here. So we can actually, if we can actually remove this part here. Okay, so there we go. We can see the different parts of the penis here. So we've got the upper erectile tissue mass here, which is the corpus cavernosum, and then the urethra is housed within the lower erectile tissue mass, which is the corpus spongiosum, which of course ends as this glans penis. So here's the external urethral orifice, and so that's that part there. I don't think there's really any more that we need to discuss about this anatomical model. So we'll have a quick look at another anatomical model, and then that'll wrap things up for this short review. Okay, so in this anatomical model here, so again we're looking at the male reproductive tract. We can see a couple of the testes. So there's the spermatic cord. So this muscle here is of course representing the cremaster muscle, and we know that has an important relationship to temperature control, so that when the male is cold, then the testis can be raised, and then when the male is warm, that can be relaxed, and that increases the surface area of the scrotum as well. And we know that we have the dartos muscle associated with the skin of the scrotum, and that has a similar effect, that it can relax to increase surface area of the skin for losing heat, and therefore we have that temperature control related to the pampiniform plexus, as we can see here, this lovely pampiniform plexus of veins. Now, interestingly, they've got the testis here, and this is meant to represent the epididymis, which is interesting because it's actually they put it almost like anterior. We know it's on the posterior surface there. So we can actually separate this model and have a look at the different parts. So we can take the urinary bladder out, and we can actually have a look at the different components. So I think this is really quite helpful here. We don't want to lose our penis here. We have our ductus deferens, which runs of course through the spermatic cord here, and then comes up, as we know, onto the posterior surface. How well we can see that. So this is the ductus deferens here, this structure here. Here we have the seminal vesicle, and this of course is the prostate gland. So if we swing that around, we can actually see there, this little depression here is meant to represent the ejaculatory duct inside the prostate. So here's the prostate. Again, we've got the pre-prostatic urethra, so the thickening of the detrusor muscle forming the internal urethral sphincter. Then we have the prostatic urethra receiving the ejaculatory ducts. Of course, there will be two of these, because left and right. And then here's the part of the membranous urethra. We've got the urogenital diaphragm here, so we've got skeletal muscle here, which helps to form the external urethral sphincter. So internal is smooth muscle, external is skeletal muscle. Here as well, and we can see this little structure here. This is the bulbourethral gland, and that's providing that lubricating mucus prior to ejaculation. That helps to lubricate the urethra, neutralize the acids, as well as lubricate the head of the penis ready for penetration. And then here we have the bulb of the penis, the start of the corpus spongiosum, and then we've got the penile urethra, or the spongy urethra, running through there. This upper erectile tissue mass, of course, is the corpus cavernosum, as we know, and you can actually see part of it here. So we've got one of the corpus cavernosa. We know there would be another one on the other side. Well, I think we can actually join these two together. Like so. And so we have these two bits of metal here representing the deep arteries of the penis, I suppose. So we've got our two corpus cavernosa surrounded by the tunica albuginea, the connective tissue capsule, and then this lower erectile tissue mass with the urethra is the corpus spongiosum. And then we have the veins here, so that when blood comes in, expands these spaces, these vascular sinuses. I don't know if this is going to focus a little bit better, maybe not. There we go. So we've got the lovely vascular spaces here, and we've got the veins here. So when these expand, impedes the venous return, and of course we lead to erection there. I think that's pretty much the main things that we can take home from these anatomical models. This skeletal muscle here is meant to represent the bulbospongiosus muscle, and there would be one associated with the crura. So this beginning of the corpus cavernosa is known as the crura, and so there's a skeletal muscle associated with that as well. So we have the bulbospongiosus and the ischiocavernosus muscle. Both of these contract during ejaculation, and that helps to expel the semen during ejaculation. Okay, so well, that's it. I hope you found that useful, sort of a quick little review of the anatomical models that you would have seen if you had a face-to-face class, and basically just representing the static images which are in that online practical on the LT Kura Cloud system. Hopefully you found the prac useful and informative, and this little video, nice little bit of revision. But I'll see you next time when we can talk more about the different anatomical parts. See you then.